So IBM Watson Health, we have 6 divisions, currently 6 pillars as we call it. So we've got imaging, oncology and genomics, value-based care, population health, government and consumer. All of those different pillars, they do cross over as well. In the UK specifically, we're focused heavily on the imaging and oncology and genomics sector, just because that's where the greatest need is right now in the UK market. But we're also focusing on primary care, how we can help the primary care physicians get more access to information as well. So that's why we're here. You know, we have core products, but we also have our cognitive solutions as well to offer. Okay, so we have some core products which the traditional vendors here would have, imaging type products, we have medical record type products. They generally will solve the problems around paper today and around moving images around the hospitals. The key products we're really focusing on here though are cognitive products, which to some people is artificial intelligence, to us it's augmented intelligence, so it's an advisor type product, can look at data, can look at images and can provide a good outcome for the clinician to be able to focus more on the patient. So it really reduces their time on computers and spending more time with the patient. So I think that would increase the patient outcomes. Global digital exemplars, we're working with at different levels in different organisations. So in some of the trusts, we are working on a very tactical level. So we're looking at some of their workflows, we're looking at how we can create efficiencies in some of their workflows. Other trusts are looking much more on the cognitive space. So they're looking more around how do they help the clinicians spend more time with the patients by us looking at information for them and helping them make a faster diagnosis or faster decision. Even from last year, we've not really moved on hugely around paper and how much paper is in these organisations. So I think the challenge for them to become truly digital is they have this issue with paper. And it's some organisations need paper for many reasons, but in order to get to a digital maturity and actually leverage cognitive, they need to move away from that, become more digital. Some organisations are there. The GDEs clearly are trying to lead the way by being very mature around digital transformation of their organisation. But ultimately, our core products can help them get there, but really to leverage cognitive, augmented intelligence, all the stuff that we're doing with Watson Health, they need to be very digitally mature. So for someone who works in the NHS for many years, I do think that it's better for them to come and tell us what they're thinking as opposed to look for a specific solution. So be a bit more open, a bit more collaborative around, I don't really know what I want yet, but this is where I want to get to. So focus on the outcome as opposed to the solution.